B.1.1.529, the latest variant of concern named Omicron by the World Health Organization, with several dozen mutations, at least 32 on the spike protein, which infects human cells. Several countries quickly imposing travel restrictions against WHO advice.
It's deeply concerning to me that those countries are now being penalized by others for doing the right thing. We call on all countries to take rational, proportional risk reduction measures in keeping with international health regulations. This includes measures to delay or reduce the spread of the new variant, such as screening of passengers prior to traveling and/or upon arrival, or the application of quarantine to international travelers. Blanket travel bans will not prevent the international spread of Omicron, and they place a heavy burden on lives and livelihoods.
The World Health Organization concedes that there is some modeling that shows travel bans could be helpful in giving countries a window of time to prepare for unexpected spread linked to a new variant, but that it's clear travel bans cannot stop the circulation of a virus that is already present, as is evidenced in places like Europe, the Middle East, West Africa, the United States, Canada, Australia, and elsewhere, with calls rather for countries to exploit testing capacity to the full, both in countries of departure and arrival. The UN chief labelled the restrictions travel apartheid against one of the most vulnerable economic regions in the world, while the AU chief condemned what he called punitive actions.
There are economic and social consequences to travel bans, particularly blanket travel bans, but there are circumstances in which in modifying travel, in reducing travel, and in adding more checks within the process of travel can help to reduce or at least delay the spread of some disease. But that in no way should be even used as a single measure. The Director General has said it, intensifying current surveillance and testing in countries. You are going to miss cases. They're going to come in your land borders. So the idea that you...
While scientists are clear from Seattle to Gaborone that they don't know what they don't know.
There are a lot of different scenarios that we're considering for Omicron, and of course it's still very early days in terms of our understanding of this variant, and again we're grateful for the information that's coming in daily. There is the possibility, we don't have all the information yet on transmission in terms of if there is a fitness advantage, if it's more transmissible. There is some suggestion of that, but again, it's early days. We expect to have more information on transmission within days, not necessarily weeks, but in days.
And while the United States points to Omicron as a cause for concern and not panic due to their domestic arsenal of vaccines and therapeutics, they have echoed calls globally for more people, particularly those with access, to get the shot.
It's also very important for countries to strengthen, expand vaccination coverage, especially in the priority populations. We know that it's people above 45 with underlying comorbidities who are at highest risk of developing severe disease after getting infection, whether it's Omicron or Delta or any of the variants. And we know that vaccines are likely to have some protection.
The world facing not just a pandemic, but a growing deficit of trust.
Everybody knows that this virus has affected the world economically and also in other aspects. And, you know, the damage is being felt by many countries. But it's also sad to see that countries who are transparent and who are contributing to new information, new knowledge, are penalized. So our call has been, since Omicron was reported, that countries to take a tailored approach rather than blanket travel bans.
This headline in Tuesday's Washington Post, capturing the global sentiment around Omicron, as the coronavirus, with all its spikes, waves, infections, deaths, mandates, and growing divisions, continues to have the last word for now. Sherwin Bryce-Pease, SABC News, New York.